Hello, everybody. Welcome
Hey, how's it going?
to Clinical Conversations with Lisa White and Dr. Greene. We are continuing our part 2 from our last discussion about the coronavirus and infectious disease. And we should probably share, this is March 20th, and things are changing very quickly. We're going to be titling this COVID-19 and Your Fertility. So Dr. Greene, can you please share, what is COVID-19? I know that's an abbreviation we hear so much about. Can you share a little bit?
Yeah, let's start with that. Each illness needs to have a designation so that we can differentiate one from another. The acronym COVID-19 is just a combination of several terms. It's Coronaviral Disease 2019 because this is a unique coronavirus that first presented itself last year in 2019. And so they basically shortened that phrase into COVID-19.
And we're just living in unprecedented times. I mean, have you ever experienced anything like this in your practice? Or
No. And ironically, there have been various models that have been studied over the years to try to predict what we should be doing if something like this would occur. And these computerized models were incredibly accurate. They literally described and tried to work out what would happen if there was a unique viral disease that was running rampant in the human population. These models actually even created a similar scenario where it went from animals to humans and started on the Asian continent. These models, the only thing that they've gotten wrong so far, literally, is that they always thought it was going to be a flu virus, which would be an influenza instead of a coronavirus, which is actually what we're experiencing. So as much as it seems like we're learning as we're going, I think we should actually realize that we have computerized models of what we should be doing. It just took us longer than expected for people to take this seriously enough to implement these models that are available.
And we're right now doing an example of social distancing right now, doing our Zoom call.
Yeah, and this is what we're doing with all of our patient visits. We've been using telemedicine in our practice for many years now because we see people from all over the world. But we even use it for our local patients. Sometimes it's more eco-friendly, but obviously we're using it for a different reason now, and we're using it universally as a way of practicing social distancing, as a way of minimizing the spread of this coronavirus.
Yeah, and I know things are just changing rapidly. You and I chatted a bit beforehand. Can you give us the latest update on where things are at right now?
Yeah, well, at the beginning of this week, the American Society for Reproductive Medicine recommended that all fertility centers stop initiating pregnancies. And they specifically said to stop all inseminations, to cancel any embryo transfers, and to complete or cancel any IVF cycles, but to not initiate any pregnancies, like to freeze any embryos, even if people were planning a fresh transfer. This was considered a recommendation. And again, the terminology is very important because, the recommendation was done with the intention of flattening the curve. And we have a graphic behind me that I'll show in just a moment as to what that term means as well. And, in good compliance with this recommendation and being the scientists and patient advocates, my partners and I reviewed this and debated this and to a certain degree disagreed about it, but we agreed to follow this recommendation. And we've been, in this shutdown mode now for several days. Yeah. One of the unfortunate things that we've seen is that some other centers are actually using it as an opportunity to try to recruit patients.
I wondered about
They're actually trying to encourage patients to transfer and saying that they're doing business as usual and acting like our decision and those of the centers that are shutting down are doing this out of a callousness. And I could tell you, I take that very personally, not only, for professional reasons, but I truly do care about my patients. And we agonized about this decision because we know how
Yeah, it's kind of
challenging it
frustrating.
can be and disappointing.
Mhm.
So, we've been very, cautious about
Mhm.
how well we should follow something that was a recommendation.
Are you finding
Now,
other people being receptive to these updates?
well, we're getting a lot of emails and
Mhm.
patients pleading for an exemption because, the recommendation is anything that is not urgent needs to be postponed. And so we were trying to even, parlay the language to a certain degree and try to figure out what should or shouldn't be considered urgent because, we know how intensive this process is and how difficult it is for people to prepare and
Right.
how disappointing it is
Oh, we
to
were waiting.
have your plans shut down.
Oh, I know.
Last evening, everything changed once again. And again, it seems like every 24 hours with this virus, things are changing. Last evening, the governor of Colorado issued a mandate, and his mandate declared that all centers must shut down beginning Monday.
Wow.
No exceptions.
Wow.
This included dental practices,
Oh,
ophthalmological practices. This even includes veterinary practices. A
mm.
complete shutdown with the state by an executive mandate from the governor of
Wow.
Colorado.
Wow.
And so we're waiting now to see how others are going to respond to this. But, this has really escalated from being a recommendation to a governor's mandate that all centers need to shut down
Very. Well, I know.
immediately.
I mean, California, right? That update just last night. The whole state is shut down
Yes.
in their home. I
And
mean,
the point of this is the reason this is being done, and our mandate here in Colorado is through April 14th. And
okay.
the point is to give us a better idea of where we're at in this process of flattening out the curve. And I know that's a term that many people keep hearing and may have some confusion as to what does this mean in flattening out the term. But before we even talk about that, I think it's also important that we provide a tremendous amount of reassurance to our patients that are currently
Hmm.
pregnant.
Yes. Can you give us any kind of update on that? I know we chatted.
Absolutely.
Yeah.
All of the available data shows that our patients that are currently pregnant are really not at any higher risk than we recorded in our previous discussion. Pregnant women are generally healthy individuals. This virus does not create any accelerated risk for them. Our concern is pregnant women, for various reasons, often show up at hospitals, sometimes with bleeding, sometimes with pain, sometimes with labor.
Mm-hmm.
And this whole process of flattening out the curve and trying to reduce the number of pregnancies that are being initiated is to spare hospital resources. It's not because we're putting our patients at danger by them getting pregnant. Anyone that conceives naturally or anybody that is already pregnant should not feel, any greater anxiety today than when we previously recorded together.
Just a
But
quick
they
question.
should be practicing careful social distancing. They should be very wary about appearing at their doctor's
I was
offices.
going to ask you about that. So, like their updates, their checks while they're pregnant. Are they minimizing those? Are you seeing?
Yes, that's a great question, Lisa. The American College of OBGYN has dramatically reduced some of the recommended pregnancy screening. And again, this is being done with an abundance of caution. Even though their OB doctor is taking all the precautions and doing all the necessary steps to keep their staff safe and healthy,
Mm-hmm.
patients have to go up elevators and through lobbies and probably walk past several other people that are already infected or sometimes even sick with this virus. And so the point is keeping people out of the offices is a way of not only keeping our patients safer, but
Mm-hmm.
also reducing spread in the community so that we can flatten this curve.
And those that are still, trying to conceive, who are you still seeing in your clinic? What kind of patients? Can I ask that?
We are still seeing patients that are considered urgent. And the point of that is we have a very clear definition of what urgent means in this governor's mandate.
Okay.
Anyone who has any condition that will not be impaired by a 3-month delay is not considered urgent, okay?
Okay.
And again, I know how long many of our patients have waited to conceive.
Yes.
And we're not asking them to wait a full 3 months. We're asking them to be patient between now and April 14th while we get better information so that we can better advise the next steps.
Are you doing anything differently to protect yourself and your patients? That was a question sent in to me.
Yeah, you know, this social distancing is not just about protecting our patients, it's about protecting our staff as well.
Mm-hmm.
You know, our embryology team, our nursing team, our MAs, our ultrasonographers, our reception people, many of them also have, you know, responsibilities, not just to our patients, but also some of them, you know, work in various hospital settings as well. And this whole idea of flattening the curve is about maintaining the healthy population as well as the hospital resources that we need in case we do see a greater spike than we're actually trying to avoid by creating this flattening of the curve effect.
You want to show us on your graph? Do you have something there?
Yeah, let's talk about this. And then the point of flattening the curve and what this graphic is showing is that the pink spike that you see there is what is expected in terms of the number of infected cases if we don't practice very careful social distancing. Now, the problem is that if you could see this line here, that dashed line represents what's considered the hospital's capacity to take care of sick patients. So the idea of flattening the curve through social distancing is a way of trying to make sure that we do not exceed what our hospitals can take care of. And so, you know, the goal is by reducing the number of infected individuals that we want to make sure that our hospitals can take care of the patients that need it. I'm going to put up another graphic that I think is also important, because this is a graphic from a World Economic Journal that shows how different companies, or I'm sorry, how different countries are doing in terms of where they're at on the curve.
Okay.
And you could see here on this graphic, the United States is seeing a rapid upsurge.
Maybe lower it just a little bit.
Yeah, I'm sorry.
That's okay. Oh, there it is. Oh, wow.
And the point is, if you look at some of the Asian nations that have taken better steps, they've really successfully lowered their increase in infected cases. And so what we're trying to do is follow the disease models that these computerized models that were devised years ago, and try to avoid the peak number of cases so that our hospitals and our hospital resources and our hospital personnel do not become overwhelmed.
No,
in fact, another interesting point, you know, I'm on staff at several hospitals.
Oh.
Most of the OB hospitals are literally, when a woman comes in labor, they're only allowing that woman alone with one person to attend. No visitors, no exceptions.
Like no doulas, no, not even their spouse?
Well, no, one visit, one person. So each person is allowed to bring in one person with them. But if things keep, going in a direction that they're going, you might even see that will be reduced even further. So again, you know, pregnant women need hospitals, and our goal here is to try to be respectful of that, reduce the number of infections, because anyone that gets pregnant now is going to be needing a hospital at some time in the future. It's important that that hospital is available to you.
I want to try and give some hope too and reassurance. Do you think around April, what did you say, 13th, 14th, 15th?
Yes.
That what will be resuming then?
That's a great question. Nobody knows. And the point is what we're expecting between now and then is several things. Number one, there's going to be a rapid upsurge in the number of cases reported. This is going to seem scary, and it shouldn't, because what we're seeing is more tests are becoming available. And so as more people are tested, we're going to get a better idea of where we're really at, because right now, we're not really sure how many active cases there are because the testing has been limited. So number one, we need better data, and we're going to see that come out. And you and I will be talking soon, and I want people to be aware it will seem scary, but don't be scared. That's just because we're getting more efficient testing. The other thing we're seeing is we're pooling resources on various different ways to keep the hospitals from getting overwhelmed. So, the second thing is, that we'll have a better idea of what the supply chain is for the things necessary, as well as some of the precautions and the treatment options that we're going to be using to try to keep people out of hospitals. So the point I want to make is that it might seem things are getting scarier, and it really should not come across that way. The social distancing, it's going to take a little longer for that to work, because people that are finally agreeing to social distancing today, we're not going to start to see benefits of that until 2 to 3 weeks down the line.
Wow.
And so a lot of these practices are just going into effect now. So we have to be aware that it might seem a little worse before it seems better.
And what kind of advice are you giving your patients when they call in and they're feeling, kind of in despair and hopeless? I mean, I don't know, what are you giving them? Resources?
Well, basically, I'm trying to share the science. It's kind of sad that in 2020, a lot of people have moved away from science and moved more towards popular opinion. If you look at the data, this virus is not mutating, which is very good, because that's part of what's letting us get a better control of it. If you look in China, China is not reporting any new cases as of yesterday. And again, they're about 2 to 3 months into this. And in many ways, many people would argue that a lot of our resources are as good or better. So if it took them 2 to 3 months to have no new cases, we should, dig in and, dig into that American spirit and see how much we can beat that by, and get this under control faster, and realize that life will return to a normal state. It's going to be slightly different normal. It's going to take longer for us to be able and willing to include larger, venues where people can be exposed to each other and in large groups.
Yeah, I definitely feel like a whole nother talk will need to be done as far as giving individuals tips and tools and ways to help them cope through this. I really believe in that holistic approach. So
and one thing that I think is very important, and a note that I think we can leave our patients with, especially our patients that are so eager to get pregnant. And I could tell you, and my colleagues, and
everyone,
we're all so eager to help them.
Yeah.
So let's dig in and talk about the things that we can start to do to help them. One of the things I want to point out, many fertility patients that have read various things or heard different things can recite verbatim that it takes sperm about 90 days to mature. But one graphic that I share with my patients all the time is that it actually takes eggs, up to 120 days to mature. And the point of that is that there's a lot of things people can be doing during these days and weeks, so that when we're ready to start initiating pregnancies and actively helping people again, that they're going to get pregnant faster. It's going to be a healthier pregnancy. It's going to be a better outcome. And there's great things in store. So stay positive, stay healthy, stay in touch, but from an appropriate social distancing format.
Yes, there's so much you can do in the prepare phase of this, and that's where I'm
absolutely, and we can easily put together some topics to talk about that as well, because honestly, I think we should look at this as an opportunity. Instead of just running into treatment, let's start training. Think of it as if it was a competition. How best would you train for like a sporting event?
You're speaking my language.
Let's try to figure out how we could train so that when you're ready, when the resources are available and the mandates are lifted, we could run forward with enthusiasm, with optimism, and with even better outcomes.
I love how you say the word opportunity. That's exactly what I just did a video yesterday on this, and it's preparing, right? Like getting your mind, your body, your spirit all
exactly
in alignment to help give yourself the best chance. So Thank you, Dr. Greene. You're awesome.
Stay happy, stay healthy, and stay a little bit distant.
And please send in your questions to us. Dr. Greene is with Conceptions here in Colorado, and you want to share your website?
Yeah, it's
enhancingfertility.com.
enhancingfertility.com. You know, I've been reading so many things about infectious disease. Enhancingfertility.com.
And I'm Lisa White, IVF Manifesting a Miracle. Thank you for tuning in with us.
We'll see you soon.
Bye-bye.